Well, we all know how taxing the COVID pandemic has been on our mental health, but the crisis as it's been unfolding on our streets and within our families is actually nothing new.
Yeah, neither is the struggle to find adequate mental health service and resources. The funding just is not there, especially when it comes to Black and brown communities. Pick 7's Jay Dow has a closer look at this important issue in our Created Equal series.
Sheila Sutton is enmeshed in the world of mental health services and wellness, both by choice and necessity.
His diagnosis of bipolar with schizoaffective disorder took 8 years to diagnose.
The kind of time-consuming and emotionally draining work that is required when the patient in question is your own son.
As far as my son, who's 46 now, oh God, 46, has been through the system, through it, under it, over it. And it hasn't been easy, and the struggle is still there.
In recognition of May as Mental Health Awareness Month, we wanted to take a closer look at how many families, specifically Black and brown families, are struggling to obtain access to adequate mental health services for their loved ones, as funding sources continue to evaporate year after year. Recent data tells the story. According to the Coalition for the Homeless, Black and Latino New Yorkers combined represent a staggering 89% of the city's homeless shelter population. Separately, studies show a large majority of New York City's street homeless population is indeed struggling with mental illness.
And the stories that they tell are the same thing over and over and over. The lack of care, the lack of follow-up, the lack of appointments. My son, 15 minutes in front of a psychiatrist asking those perfunctory, how you doing, how you eating, how you sleeping, here's your prescription. It's crazy.
Sheila is a registered nurse and member of the New York branch of the National Alliance on Mental Illness, or NAMI, a nonprofit which bills itself as the nation's largest grassroots mental health organization. Within these support groups, there are all too familiar stories of state and local governments reducing the number of available psychiatric beds and other acute services. The coronavirus pandemic only exacerbated the crisis, putting on full display a growing number of street homeless in our region suffering from mental health issues. So even as we creep out of the paralyzing grip of the pandemic, a recent study by the Coalition of Behavioral Health concludes, quote, behavioral health agencies are starting 2021 seriously weakened by the first wave of the COVID-19 pandemic, with reserve funds depleted and many in the workforce traumatized.
It has become a revolving door.
Danu Sanasi sits on the board of directors for the New York State branch of NAMI. She says local mental health agencies and healthcare facilities, including hospitals, are simply falling behind.
Because of the lack of funding, also the lack of psychiatric beds, there is no stabilization center. So the long waiting periods in the emergency rooms. It's very difficult to find the psychiatrist.
What's the solution? In a perfect world, funding increases. In the real world, it's another story.
It's been more like, I'd have to say, death by 1,000 cuts.
David Woodlock is the CEO of the New York City-based nonprofit Institute for Community Living, or ICL, which houses some 2,300 people on a daily basis, many suffering from mental health issues. Woodlock blames funding cuts on one of the most basic and most important services for those suffering from mental health issues: supportive housing.
Rents year after year, as everybody knows in New York City, went up year after year after year. And yet the funding that we got to help provide safe, attractive homes for people never went up.
The end result? The mentally ill often get lumped into the same bucket of care, regardless of their actual circumstances or need, as Sheila Sutton says she's discovered all too often.
What is it when my son is discharged to a shelter where there's rampant crime, and no kind of care for his illness? Like, it's just not fair.
Sheila's son is 46. He was first diagnosed during his freshman year in college. That gives you an idea of the decades-long journey that her family has had to endure. Sheila tells us that families affected by mental illness often are left to relying on one another to get the help that they need. Corey, Tamsin?
All right, Jay, thank you.
Yeah, and to watch all of our Create Equal stories, Go to our website, pick7.com/createdequal.